Hello people. Today I want to talk about uterine fibroids. They are also called uterine leiomyomas. Basically, a leiomyoma means that it is a tumor, a benign tumor that has risen from smooth muscle. So in the wall of the uterus, here, there is a lot of smooth muscle. The uterus has this middle smooth muscle layer that is actually the biggest layer out of the three layers of the uterine wall, and it has a lot of smooth muscle. And from these smooth muscle cells, sometimes a benign growth can appear that is called a leiomyoma, or for short, it is called myoma. So basically a smooth muscle tumor. These tumors are typically found during the middle and later reproductive years in women and after menopause. So after menopause, these tumors actually tend to decrease in size and they tend to calcify. So they decrease in size. So basically, in menopause, these tumors tend, the symptoms that they create, if they are symptomatic, the symptoms tend to go down because the tumor is decreasing in size. And why is that? These tumors are they have a lot of receptors for estrogen, for hormones, and in menopause, the women have less of these hormones, so the tumor actually has no stimulus to grow and it is decreasing in size in menopause. But in the reproductive years, when there are a lot of hormones there, these tumors can grow and can cause problems. Etiologically, people say that a lot of it is pushed on the genetic level, that everything is blamed on the genes, but it is found out that a healthy diet, so fruit, vegetables, can lower the risk of these of developing these tumors. But an unhealthy diet, a lot of fat and meat, can actually raise the risk for developing these tumors. So pathophysiologically, if we look at these tumors, they are actually macroscopically rounded masses. They look like solid nodules or multiple nodules, or they can even be bigger masses containing a few of these nodules. If you microscopically zoom into them, they actually contain smooth muscle cells, or cells that are resembling these cells, only scrambled in all ways. The important thing now is that these tumors are classified mostly by location. So where are they arising in the uterine wall? For that, I made a slice of a normal uterine wall. So a normal uterine wall has the endometrium. So this is basically the epithelium that is here. So towards the uterine cavity. And this is also called, the endometrium is also called the mucosa. Then there is the myometrium. This is the thickest part of the uterine wall. It would be in the middle. And this is called also the muscular layer. And as you can see, it has 3 layers. It is subdivided further into 3 layers. And we have this last layer. So you see that it is not that thick. This is called the perimetrium, or it is also called the serosa. And this endometrium is called the mucosa. And this is the muscular layer or the myometrium. So the myometrium has a submucosal layer that is underneath the mucosa, a middle layer that is also called the vascular layer because it has a lot of blood vessels, and a third layer that is called a subserosal layer because it is underneath the serosa. So this is important when we try to describe the location of these tumors. So the tumors can be located most of them are located actually in the wall, but tumors that are specifically in this part, in the myometrium, so in the muscular part, most of them are called intramural. So if this tumor that is basically in the myometrium, so it is in this part, this red part. If this tumor is only located here, it is basic, or maybe a little bit here. This tumor, when it is only located in this muscular layer, this tumor is called an intramural fibroid. Sometimes when people say intramural, they mean somewhere in the wall of the organ. But also, in this case, intramural means that it is somewhere in this muscular part of the wall. Tumors can obviously be located in the muscular part, but sometimes the tumors are also located in the muscular part, but they are also underneath the mucosa, so underneath this endometrium. For example, like this tumor. So this is basically an intramural fibroid because it is in the wall, but because it is, for example, this is a representation of this case. So basically, this tumor is in the wall, but because it is underneath the endometrium, underneath this mucosa, it is also called a submucosal fibroid. So basically, this tumor is in the wall, but it is very near underneath this mucosa. Because of that, it is called submucosal, underneath the mucosa. The second case is this case. So in this case, we have a tumor, for example, that is underneath the third outer layer, the serosa. And because of that, it is called a subserosal fibroid. We have also fibroids that arise in the cervical part. So this is the cervix of the uterus, and this would be an intramural fibroid in this area. It is also called a cervical fibroid. So these are basically these main locations, main descriptions, but there are also these tumors that have these stalks, and they can be underneath the epithelium. These are called actually pedunculated, so they are on a peduncle. They are called pedunculated submucosal tumors, and these are called pedunculated subserosal. And these are only submucosal because they are underneath this mucosa. So what is the interesting thing about these tumors? Our female patients can have these tumors and they can actually be without any symptoms, so they can be asymptomatic. But there is a possibility that these tumors cause pain. There is also a possibility for them to cause bleeding. There is also a possibility for them to cause, basically, because of this bleeding, they can lead to anemia and iron deficiency. They can also make pressure on other organs, like the bladder, which will have its problems, and they can also cause, but this is very rare, problems with pregnancy. So patients that have problems with these myomas, everything, when it is found out, basically with a patient comes, tells his symptoms, so maybe pain during intercourse or anemia, heavy periods, unusual periods that are accompanied with heavy bleeding, pain in this genital region, frequent urination, and so on. And we do imaging and we find these myomas. Then and we don't find anything else. Then basically it all depends, the therapy depends on how severe these symptoms are. Of course, if there are pregnancy problems, the issue needs to be resolved. Of course, if there is severe pain, we need to treat it. If there is bleeding and anemia, iron deficiency, treatments needs to be done. Of course, if there is pressure that leads to a lifestyle that cannot be tolerated, this needs to be corrected with treatment. But if patient has only maybe a little bit more pain in periods, then only, for example, some pain medication is prescribed to be used only when the pain is marked. But the thing I want to emphasize, depending on the severity of the symptoms and the severity of how these myomas impact the life of the patient, depending on that, we do the treatment. So the treatment options are medication that can shrink the tumor, medication for symptoms, then also ultrasound guided destruction of the tumors, and last but not least, the many operative techniques that are used to eliminate these myomas. Basically, the medication, so if we're talking about the therapy, a safe way is to use medication to shrink the tumor, but it cannot be a guarantee that it will be eliminated. Also, a safer way is ultrasound waves that are guided to destroy the tumor. And of course, the most aggressive way are different minimally invasive or invasive operative techniques that can eliminate the tumor. Basically, these myomas, they can make a lot of problems. Sometimes they can be asymptomatic, but on the other hand, they can cause bleeding, anemia, and many other problems that we have from there. So sometimes they can be only treated with alternative medicine, but on the other hand, sometimes we need to be aggressive and treat them operatively. Thank you.